just want to thank you all for coming to West Springfield. It's nice, the crossroads of England, as I pointed out the Joel, candidate for council, and Chicopee in the back. It's great to have everyone here, and it's unfortunately, I'm in this Leadership Pioneer Valley course for young leaders in the region, and in Springfield a couple months ago we had a tour of the city, got to see a bunch of different spots, got to go on a safe routes to school with one of the schools over there, which is very interesting, which we're trying to work with here through Gene. And they gave a little presentation about county rankings, and they showed us, now we had a bunch of people there from the whole Pioneer Valley, so from Franklin County, from Hampshire County, and a couple from the Berkshires. So we're in Springfield, in Center Hampton County, and they show the rankings and we're last. And I'm like, whoa, what's up with that? Like, well, you've been last for a long time, so. That was at least 7 years the data shows back. And I immediately pulled my phone out and texted Jean and said, well, what can we do here? She said, well, the new rankings are coming out soon. We're probably not going to move, but we can talk about it. and just briefly looking at them, it shows physical activity was one of them. And it says 94% of the people in Hampton County have access to physical activity, but 25% are physically inactive, 28% are obese. So there's definitely things we can do and maybe ways to change that and to change socioeconomic statuses of the surrounding neighborhoods, surrounding cities. And as mayor, that's something we're always doing here, with the help of our representatives and our senators in Boston. But you all are the experts, so I'll end with that. I'm looking forward to hear what your thoughts and ideas are, so how we can move forward. And you have my support and the City of West Springfield's support. So thank you very much.
Thank you, Mayor, for those remarks and support. It's awesome. All right, next up of our presenters is Dr. Frank Robinson, who's been a stalwart in the area of public health for many, many years and has more expertise than I could even explain. So, Frank, you want to take it from here?
I'm going to read to you what the report says. So everybody has a copy of this, so you should have picked it up. And I'm going to ask you to turn to a section that breaks out the rankings of measures and national and state results. Page 5. Oh, excuse me. Get this one. So let me just sort of put the county health rankings in context. You can read it as well as I can, but I want to ask us to sort of get behind the tables a little bit. So in 2010, when this came out, Hampton County ranked last. In 2017, when this comes out, Hampton County ranks last. Okay, so there's been no appreciable movement in the health rankings for a long time. If you go to County Health Rankings website and download the spreadsheet, you'll get some of these same figures. But you can actually start to peel it back a bit. They have all these sub-files, sub-tables to look at. And I sort of started looking at that, and I said, well, what accounts for this number 14 ranking on a consistent basis for the last 17 years or so? And so when you start peeling it back, you get a glimpse of some of the indicators, and they're listed here, particularly under the health factor category, of things that are sort of out of sorts. So I was surprised to find that Hampton County was somewhere around 11, 12, 9, depending on the year, in quality measures for healthcare. And I said, oh, that's clinical measures. So that's really interesting. So what is that about? And as I peeled that back, it really is about ambulatory sensitive conditions. Or in other words, how many people are hospitalized that could have been prevented if there was a more appropriate community response. So in some ways, even the clinical measures speak to the absence of upstream solutions that prevent people from being hospitalized, whether it's access to care or other major social barriers or challenges such as transportation. So when you think about the county health rankings, even the area that's referenced as clinical care, when you really start pulling back and understanding what accounts for those measures, they're really upstream and or in some ways non-clinical measures to begin with. So I say that to say that our health rankings as a number 14 are clearly a bold and enduring statement of the status, the condition of our communities, the level of organization or disorganization in some of our communities, the inequities that exist in some of our communities. In the old days, we would simply say, well, it's probably because of the concentrated problems in Center City, Springfield. But when you look at the most recent health needs assessment that was produced by the hospitals within this region, and they start to lift up challenges in rural communities, whether it's Noble, the hospital, and their needs assessment for Western region, or the Wing, Mary Lane hospitals for the Eastern region, you get a glimpse that there really are some significant health problems and challenges in those communities as well. And that the poverty and the inequity that exists in Center City or the urban core exists in the rural areas. The dynamics are a bit different, but the inequities and the problems exist there as well. So our communities, in fact, are disorganized and challenging places to live, grow, and be healthy in. So the obvious solutions, if I was to be prescriptive, is that we would begin to reallocate resources from healthcare to community care. We fix that clinical community divide and provide more upstream community-oriented solutions. And our health rankings would begin to shift in a lot of ways. I think the hope and the energy I got from reading such a negative report is that when you look at some of the factors leading to the overall rating, those factors are in fact things that we can do something about. Teen pregnancy, preventable hospitalizations, there are elements and solutions embedded within this overall ranking that really can make a difference in if we were actually to begin to reallocate our resources and change health policy in a way that favors upstream solutions or social determinants of health. And I think I'm going to stop using that word as I leave the podium. I was doing some work looking at community health workers. And a group has started calling social determinants, if we could only better meet the core essential human needs of our patients, core essential human needs, then folks would be healthier. And so that is far more illustrative of what the social determinant is: food, shelter, transportation, core essential human needs. So this report tells us that we're not doing a good job in meeting those basic human needs. So did I do my job?
Yeah.
All right.
And I apologize, you were using the Massachusetts report, and I assumed you were using the report of the other one, which is why you didn't find the pages you wanted on. So, my mistake. And we are going to go into our next presentation on the social determinants of health, because that's what's written on your agenda. We'll use that term for now. And this presentation will be from Jessica Collins, who's the Executive Director of Partners for Health and Community, and also well-versed in public health matters in this area.
Thank you and good afternoon, everyone. And Brett Vega just said, come on, this is the choir. This doesn't need to take 2 hours. So with that pressure, I was asked to speak on social determinants of health. And I want people to be honest. How many of you feel as though you don't know what social determinants of health are? One. Okay, so I'm going to explain a little bit. Thank you. But basically, very much what Dr. Robinson just said, which is that 70% of what determines people's quality and length of life is actually happening outside the hospital walls. and it is the very socio and economic environment that we live in, our homes, our schools, our communities, and this visual is in that report. And I always like to show this because I really want to be very clear that the time for sort of blaming individuals about the health choices that they're making is way past. That was the 20th century. We're in the 21st century, and we need to understand that individuals can make their choices based on what is surrounding them. And I know I've shown this slide quite a bit, but for those of you that haven't seen it, this is some regional data around male life expectancy by county in Western Mass, and it highlights the 3.5-year difference between Hampden and Hampshire counties. And you'll see in your county health rankings report that Hampshire County is actually doing quite well. And when you think we all live along the same riverbank and breathe the same air and have the same grocery stores around us. And here's a slide on premature mortality by town, which is potential years of life lost per 100,000. And you can see a striking difference between an Amherst and an Orange and Springfield, etc. And so it makes us take pause to think about this question of equity, which Frank just mentioned. What are the resources? Where are we investing? I was at an event last week and a physician from 140 High Street Health Center said, in that reality picture, I'd change it and actually have something pushing down on the little guy's head. And I thought, wow. So in the community, what you are going to hear later is about the Community Health Improvement Plan, and it ties directly back to the Community Health Needs Assessment. So I just want you all to understand that it's a journey, and we're not all doing things separately. We're actually doing things strategically together. And so in Hampden County, in the Community Health Needs Assessment, we absolutely food deserts across the county. Urban and rural, it's an issue, and some new maps just came out that we can probably get up on PVPC's website. Bay State Wing, domestic violence for sure. Some really alarming statistics from the courts and the police departments around violence in those homes. Bay State Noble, health literacy rose up as something incredibly important to focus on. And again, housing and behavioral health, I meant to add in here, of course, across the county as issues. So these will be consistent themes. So the last I just want to end on is that, of course, we need to be doing things in our hospitals, partnering with hospitals and community, and then doing things on a total population level, which might be an example like water fluoridation or grocery stores, things that will affect hundreds of thousands of people at once. So all three types of strategies need to happen. And of course, I love the metaphor about the downstream and the upstream, and totally, this chip is about upstream solutions, and hopefully everyone will be joining in. There have been a tremendous amount of partners who have created this, and it will take all of us to implement it, and so we're not 14th anymore in the state. So thank you very much.
Being so speedy too. All right, so we're going to get, as Jessica said, to the nitty-gritty of the CHIP report now, the health improvement plan. And to do that, you're going to hear from the author. Oops, that is not what I wanted to do. Apologies. That's where I was the first time, wasn't I? All right. There we go. Okay. So Catherine Rattay from PVPC is going to come up and present on the report.
Thank you. Hi, everybody. Thanks for being here. Jean called me the author of the report. I'm certainly not the author of the report. I'm just the person who took everybody else's input and put it into a flow. And other people designed it. So I want to make that clear. It's not my fault, unless you love it, and then I'm responsible. No, I'm just kidding. Of course everybody loves it. How do I move this forward? So my here just to tell you the process, because again, I think it's really important that this was a collaborative process. We really have, I think, I've been working at the Pioneer Valley Planning Commission for 18.5 years, and in my experience, we used to be here in West Springfield, and then we moved our offices over to Springfield, and I live in Springfield, and I feel like In Hampden County, we've really come a long way in terms of breaking down silos and working together to solve problems and building on efficiencies. And so again, obviously the purpose was to bring the right people and the right organizations together, to work together, to come up with a plan that would move us forward so that we're not last. And obviously we don't want anybody else to be last, but we all want to be tied for first. And the people who are involved are all of you who are here in the room. It's important that we have elected officials, because especially our state and representatives and senators, because they're the ones who can actually change the laws and make sure that we can institutionalize these things. Yesterday I was working with the Mass Motion coordinators in Hampshire County, and I was thinking as a Peace Corps volunteer about, we're not giving people a fish, we're teaching them to fish. But in some cases, we're actually having to, put in a fish pond or put in a stream so that there's actually fish that people who know how to fish can access the fish. So we really have to go a step back. So anyway, we have obviously the elected officials, the providers, the colleges and universities. University of Massachusetts has really been instrumental, and we need to get the other colleges. American International College was really active. Foundations, the Pioneer Valley Planning Commission, your regional planning agency. Municipal officials, again, are extremely important, because at the local level, it's a wonderful thing about Massachusetts, we have home rule. It's also a terrible thing about Massachusetts, we have home rule. So we have to work with our local officials to make sure that the local regulations support what we need to do to actually make it possible for people to walk and ride their bikes and walk to the store. Law enforcement, we need to engage law enforcement better, especially one of the areas that I work in is Complete Streets, helping communities implement their Complete Streets policies, which means make their streets safe and comfortable for all road users. And I always thought that parents wouldn't allow their kids to walk to school because of traffic. But now it turns out that some parents don't let their kids walk to school because they don't feel like it's safe with respect to crime. So obviously we have to get law enforcement involved. And then of course businesses and residents. So you've heard these facts about our region, you live here, you know these facts about our region. But it's important to make the case, and we did when we first started this process, that poor health outcomes are hurting us financially. They're obviously hurting us economy. We're wasting lots and lots of money that we shouldn't be if we had better health outcomes. And so we need to do a better job of investing our limited resources. We have significant inequity and varied access to opportunity. For those of you who aren't familiar with the Fair Housing Equity Assessment that was developed for the Pioneer Valley, there's also one for Franklin County. An incredible documentation of the history of segregation and the difference of access to opportunity based on people who have means, people who are of different races. The social determinants of health, as you heard from Jessica, we have to have a comprehensive approach to improving our region's health outcomes. It is about the physical and the built environment and our regulations and our access to health care. And the other wonderful positive thing is that we have all these amazing examples of programs that work. When we were doing some of this outreach, people got mad when we came and presented the data of how we're still last, because people who've been working in this field, like all of you, are like, how can that be? We've been working so hard and we're so connected and we're doing so much better than we were. How can we still have these bad health outcomes? So there are these amazing initiatives out there, and we just have to figure out how to scale them up. And we're also all very good at getting grants from the public and the private sector, but the problem is sustainability. You get a grant one time and then it's gone. So you do all this great stuff, but then you can't continue it. So that's why we really have to have our elected officials here to change the way funding is provided so that it's sustainable and it's not just grant by grant. So we have the lowest health ranking, but we have significant resources to address the problem. And the Affordable Care Act is changing the health landscape in the United States, which is an important piece of the national context, which again, who knows how secure things are, but right now we believe inevitably that we are moving toward incentivizing health and prioritizing prevention as insurance providers move from fee-for-service to a global type payment. This is, complicated, jargony sounding language, but it really is huge in terms of how we can actually get more resources for prevention. We also have the State Department of Public Health representatives of whom are here that are really providing us with a great framework in terms of the state health improvement plan that we can plug into. And also we have 22 out of 200 elected officials here in Western Mass, so we have a force that we can make change. And again, we have some of the highest healthcare costs in the country, but costs are growing at a slower rate than the rest of the country, and we have some of the highest rates of insurance coverage. So there are lots of positive things to celebrate. So our approach, as others have said, is don't compete, cooperate. And again, I'm not the author of the plan. All these people donated their time and did an amazing job of thinking through how do we actually overcome these barriers. So we took a best practices or a strategic planning approach, figuring out who's doing what, how do we replicate it, what's already happening that we can piggyback on. And we recommend figuring out how to integrate health considerations into municipal and private development decisions through using tools like health impact assessment, so that, again, we're changing the way things are built forever going forward so that we don't have unhealthy environments. And then again, we have to build evaluation and implementation into the plan. So how did we do it? Thanks to our state government, we have a program called District Local Technical Assistance, which funds regional services projects, and we were able to use some of those funds to support our staff time, to convene the work group, with a big push from DPH in the Western Mass office. We did do a forum back in 2014. Frank was the one who got us all thinking back in 2010 when he came and did a talk at the Pioneer Valley Planning Commission saying we're worst. Hampton County is worst. So then we followed up with this forum in 2014. A lot of people came and just did a wonderful brainstorming of all the different things we needed to do. And then again, we're very fortunate to have in Western Mass, we have all these strengths of cooperation and collaboration. Our hospitals in Western Mass work together on their IRS mandated community health needs assessment. And they do that every 3 years. So instead of us having to do any more data collection and research, all we did was take all the work that they were already doing and use it to inform the planning. So thank you to the Western Mass Hospital Coalition. And happily, it was the Pioneer Valley, it was Collaborative for Educational Services and the Pioneer Valley Planning Commission who were hired by the hospital to do the data collection and analysis. And then we were able to secure another round of DLTA funds to continue the process after the 2014 initial work. The Robert Wood Johnson County Health Rankings funded a legislative breakfast, which many of you were at last fall. And then finally, we had a half-day work session that many of you came to, and you actually just took the time to think through what are the strategies that we need to do to overcome the different priority areas. And my colleague, Kathy, is going to tell you in more detail about the specific strategies. But again, I just want to thank all of you who donated your time to really move this forward.
Thank you, Catherine. I appreciate that. And thanks to everyone else. There were a lot of folks in the room who were working on this. That's good. And Kathy, you want the chip book, right?
Yes.
You want the PDF that I lied about that Frank was using, right? And okay, there's the beginning. All right. You want to introduce yourself? All right. So this is Catherine Moss, doctor, Vice President of Integration and Behavioral Health Network, and I know she's been very integral in moving portions of this along, and she's going to tell us more about that.
Hello. So originally when I was asked to do this part of the presentation, I thought it was a tremendous honor to be included in the presentation. And then I heard Frank stand up and say, "No, I'm not going to read you the plan." And I went, wait a minute. That's what they asked me to do. I don't know what I think about that. So I'm not going to read you the plan, but what I am going to do is try and give you some highlights of it so that when you do read it, it starts to fall together a little bit in your mind. So everybody's been talking about the county health ranking, which I'm going to zip to real quick. Just mess this up.
The page number in the box.
And the page number in which box?
And it's not very big, so depends on how much you want people to read.
Okay, so this is what everybody's been talking about, and it's on page 36 and 37 of your report. And the working groups used these to identify the primary domains to be addressed and also to set some of the goals, in addition to the CHNA that was already discussed. So the domains are also listed in your report, and there are 5 domains.
So one place, just simply on the table of contents, on bullet point 3, you can see that. Domain 1, health equity and health disparities. So I'm going to tell you just a little bit about what Hampden County is putting forward for that. That is really looking at making changes. One second. All right. So this is the first domain, health equity and health disparities. And the goal of this is really looking at policy, impacting policies that impact people from marginalized and vulnerable populations. And they're looking at doing that in 3 ways, the objectives on page 14. The first objective is at 3 levels. One is at the individual level, one is at the institutional level, and the third is at the municipal level. So by 2017, the goal there is to identify emerging leaders in the target populations of marginalized and vulnerable people in our community and help give those people the resources and the capacity to lead around some of these issues of inequity and health disparity. The second goal is by 2018 to identify institutions who are going to work on institutional racism, institutional oppression. And the third goal is by 2020, looking at 2 key municipal policies and making actual change at the municipal level in 3 or 4 different areas, 3 or 4 different communities, 2 key policy changes that will affect health disparities in our area. And there are a number of strategies I won't read to you that they're going to try and do that. So again, the first domain of health equity and health disparities will be looking at changing policy that affect our vulnerable populations at the individual, the institutional, and the municipal level. Okay. Domain 2 is behavioral health, which is my domain, so I'll try not to inappropriately talk more about this one. But that one is on page 18. And the goals, our work group really went right at the county health rankings and said, you know what, we are going to move out of last place. And the only way we're going to do it is to focus on those exact indicators and try and move the needle. So the indicators we looked at were 5, that we were lowest on preventable hospital stay, high rates of poor health and poor mental health, adult smoking rates, excessive drinking rates, and premature death. And so we wanted to target the behavioral health components of those 5. So the goals reflect that. So if you look, ours is kind of long, but page 18 to 21 will lay out for you the goals, objectives, and activities that align with those 5 health ranking indicators. So goal 1, if our problem was that we have really high rates of preventive hospitalization, well, our goal is to reduce that. And so we have a number of activities we're going to address. There's a huge correlation between behavioral health comorbidity and preventive hospitalization, both for medical and behavioral health conditions. So we're going to do a number of things to destigmatize behavioral health so that people want to access it, make it more accessible, so looking at workflows, a number of providers, how people get to providers, looking at making the services, the treatment models, and the providers that are providing behavioral health services more culturally synonymous with the populations that we treat so that people feel comfortable. So they know who we are in the treatment world, they can access us, and when they get there, they feel like they get help. So those would be the goals for that. Sort of the same things around reducing poor mental health and physical health days. People said that the more days than not in Hampden County, they don't feel good physically and they don't feel good emotionally. So we need to change that by getting access to preventive care, education, and treatment. Reducing smoking, reducing drinking, and reducing premature death. The 3 for premature death, fatal drug overdose, a huge opiate epidemic, so we're going to really focus some of our activities on that in Hampden County. Also, people with severe and persistent mental illness on average die 25 years earlier than people who don't have that, and so we can reduce our premature death in our county by addressing that population, and also suicide prevention. All right, everybody still awake? Great. All right, so domain 3. You will find the goals and objectives on page 26. So that one is focusing, that domain is primary care, wellness, and preventative care, focusing specifically on chronic disease, infant mortality, and access to quality care for all, is how they want to frame that goal. And they've got 3 objectives, as you'll see. Preventable use of the ED, the rates of STIs going down, and the rates of cavities going down. And the strategies that they're proposing for that can be lumped into 4 general categories. One, the first bullet under the first section under strategies is really focused on the primary care workforce. How do we get more people doing primary care? And so those initiatives are around making it more prestigious, giving more incentives for people to go into primary care, tuition reimbursements, things like that, expanded office hours. How do we build our primary care workforce and accessibility? The second section of strategies is really around preventive health activities. So getting dental screenings in place, getting condom distributions, getting STI screenings, and then protocol changes. So primary care providers, pediatricians doing fluoride varnish to children, changing the risk assessments, changing the reimbursement codes, looking at infrastructure, policies, workflow to address some of this. And then the last section of strategies around this is community outreach efforts. So mobile integrated health programs, outreach to elders, dental care to schools, CHWs in the home. So those strategies are all about getting those services out into the community. All right, 2 more. You're still with me. I love it. All right, domain 4, healthy eating and active living, is really on the physical environment. Changing our physical environment so that people have better access and will use healthy food and get physical activity. So the first section of objectives is around increasing access to healthy food. Full-line grocery stores, getting more healthy food into the bodegas, farmers markets, school gardens, things like that. The second section of objectives is really around increasing infrastructure. So I'm on the top of page 30. Increasing the infrastructure and changing the infrastructure to make walking and biking in our city more accessible, which is someone who loves to bike to work. That's really great in Springfield. So making sure that people are encouraged to walk and bike and are safe doing that. Just as a quick aside, I used to commute by bike in Boston, and now I commute by bike in Springfield, and people say, you commute by bike, you did that in Boston? I said, Boston's so much easier to commute by bike because everybody does it, so people expect it. When you commute by bike in Springfield, nobody expects you to be riding your bike, so that cars have no clue, and there aren't safe places to go, so great job, domain 4. The next section is on increasing our goals around reducing weight and increasing physical activity. So that's more about individual people reporting improvements in those domains. The next section of those objectives are around increasing benefits to underserved and under-resourced populations, WIC benefits, SNAP benefits, things like that, so that people who don't have resources can still buy healthy food. And then for people with jobs, employee assistance programs, giving more benefits. The next section is really around policies and regulations. Soda tax, limiting the number of fast food restaurants, things like that, increasing food stands. And then the 5th domain, public safety, violence, and injury prevention, is really around improving safety, reducing violence, and informing public perception. And that one is really based on a lot of existing programs and wanting to expand and replicate what's already successful in our community. Improving police-community relations, changing policies. But they're focused on, there's a lot of real wonderful programs, the C3 initiative, Holyoke Safe Neighborhoods, the Safe and Successful Use Initiative, Shannon, all of these projects out there that this work group and domain will really focus on expanding and enhancing. Any questions?
Thank you very much, Catherine. I think I want to do a little bit of a follow-up to what she was saying too, is that the document that she's giving you is, it's not a final version. This is a living document as we go along. Things will change, as society changes, it can move. If you haven't been involved in the process, absolutely get involved. If your organization is out there and hasn't been identified yet, please, that's all, as Catherine Rattay said, we need to work together on this. It's a group project. Having said that, we're going to move on to more talk about collaboration. And Representative Vega will do that presentation.
Well, good afternoon, everybody. Nice to see everybody. Friday afternoon, the weekend is here. The sun is somewhat out. I'll also add that when I told Jessica that this was preaching to the choir, that we didn't need an hour and a half briefing, she also said she was going to leave before I spoke. So I said, well, wait, let's get this thing moving then. Couple of things. The advantage of being towards the end is I can just sort of reiterate what's already been said. But first, let me just say that it's really been a great experience working on this, because like many of you, and as the mayor indicated at the very beginning, I was unaware of this. I was on the city council for 4 years, never heard of the healthcare rankings, became a state rep and got invited to a meeting with Josh, and him being a friend, I was like, sure, I'll go to a meeting. That's what I do all the time. I'll go. Having no idea that I'd become this invested in this process. Because it's been rewarding, I got to work with a lot of great people. It's reaffirmed a lot of what I already knew about the health issues in Hammond County, in particular in Holyoke, but it's opened my eyes to a lot of other issues, especially in the rural communities, and how similar we have in our urban and rural issues. That just because towns like Holland and Russell and Hampton only have a couple hundred or a couple thousand people, they're still having the same food desert issues, access to health care, activities, teen pregnancy, and of course mental health and drug addiction issues. So I think in a lot of ways, this plan brings the community and the county together. And that I think is really important and exciting. You've heard the ideas of strategic investments and collaborations, and it's got to be local, it's got to be at the state level. A couple of things I think are positive in what we're doing thus far at the state level. We have seen increased investments, obviously, in mental health. We've seen increased investments, obviously, in the addiction realm of the world that we live in. But we're also trying to be a little bit more innovative. And you heard someone mention, I think our last speaker just mentioned mobile integrated health. Key. If DPH gets those regs out, we get those grants out, mobile integrated health will reduce those hospital room visits and have the ability to have more of the proactive, preventative model of meeting people where they're at, be it in their home, be it in the community, to make sure that they're taking their meds, seeing their doctors, and curbing that visit to the emergency room. Though we will have a brand new, beautiful emergency room in Holyoke, which we all want you to come visit. We just want people who need it to come there, not the frequent flyers to come there. Preventive Wellness Trust Fund, a huge program that the state put forward. I see some head shaking, some of you involved in this. The time is of essence right now. The program runs out this year. Financially, we're looking to restart it, to put that assessment on our good friends in the insurance companies, to create this preventative model. It's what we've seen with the Prevention Wellness Trust Fund and this action on the ground, again, of just not writing a script to someone saying, here, go take care of this, and while your daughter's missed 30 days of school this year, I wonder what's going on, but she's staying back. It's saying, what is the root of the problem? If it's obesity or smoking cessation, here's a reference, here's a recommendation letter, a prescription to go to the YMCA, and the next day you get a call from the Y saying, hey, come on down, right? More proactive. It's going to the home of that young girl who's missed those 30 days of school, find out that she's asthmatic, find out that there's mold in the household, working with the housing authority, working with the school to fix the root problem. And that's what all of you do, and it sometimes takes the legislature maybe a little longer to catch on, but I think that we're there with you. I'd also mention the HIP program, the Health Incentive Food Program. We talk about food deserts out in Hampton County. A lot of our communities have farmers markets. Those SNAP benefits are doubled at those food markets. Such a great way to support our local farmers and support getting healthy food into our families. So the HIP program, another great program we put forth. And I'd also mention that DPH recently, well not recently, just 5 years ago, gave a grant to places like Holyoke. And we started a now called HashPack, and I don't remember what the acronym is. But in the last 5 years in Holyoke alone, we saw a 52% reduction in teen pregnancy. 52%. The goal was to reduce it by 10%, and we went 54% in 5 years. Now that, and what was mentioned earlier, that grant ran out. So all the organizations that are at the table are now like, well, we can't really send someone to the table, we're too busy. We're saying no. The mayor and I, we just had an event, we're saying no, we need you all back at the table. We need to figure out how to sustain this. 54% reduction. We don't want to go backwards. As he said, I'm not here, thank you for being here, doctor. We don't want to go backwards, we want to keep that moving forward. Now we're still third, but we're not number one in Hoyoke anymore, right? So one of the things we don't want to be number one for. But this rankings is so thorough. Right? I think that they look at all those details, and we've just got to move the needle on a handful of things, expand those programs, and hopefully, get to be tied with 10th, right? Or 11, or 9, or 8, or maybe at some point all tied with number 1. So the last thing I want to say is that at the state level, we are a partner in this. I know that Senator Welch was here. I think maybe he had to step out, but we've had meetings with representatives and senators. They get it, right? They get it, but we need you to keep on them to make sure they understand it. We need to expand our circle of collaborators to make sure that all the organizations that are working with teens, with mental health issues, on the drug addiction, on homelessness and housing, that everybody's at the table. This table needs to get bigger and bigger and bigger. And with that, we will make a difference, because I want to say this, the time is now. You see that, you hear that all the time, but essentially the time is now. There's so many positive things happening, but we're facing a burnout. I worry about all these organizations and their healthcare workers and their PCAs and all the people on the ground, many of you doing this work for decades, burnout. Not only burnout, is there a new group of leaders coming up to carry on this work? And what was mentioned, if we can lay the groundwork here with things like complete streets legislation and ordinances and zoning to get the groundwork done now, so that in 5 years we're not having the same conversation. We're building upon what we've done. So I thank you all for the work you're doing. I look forward to continuing to work with you, but I stress that the time is now to get this needle moving, to all work together, and to really recognize each other as partners, not competitors, and to collaborate, and we will move the needle. So again, thank you to everyone involved, and look forward to working on this continually.
Thank you very much for all of it that you do, and if you need our help up there somewhere, you let us know. All right, after this, we're getting close, and as Aaron asked for earlier, we're doing it faster than we thought. Fortunately, all of our speakers are here now, and we are up to Commissioner Colton Harris of Springfield to do a call to action.
I need a little energy in this room. This is an absolutely wonderful group of individuals. This is a positive place we are. We are here really to have a conversation. You've had a lot of information that has been given to you. And first of all, let me start by thanking each and every one of you in this room who does this work. This work cannot be done in isolation. It is partners and people are across the Commonwealth of Massachusetts, and particularly in the Western region, working together. So I applaud you for the work that you do and the work that you continue to do. I also want to thank the authors and those contributors to the document that has been given to you around the County Health Improvement Plan. A lot of thought, a lot of work, a lot of sweat, a lot of collaboration went into creating that document. So let's give them a round of applause for their work. And so I have been charged to give a call to action. Now, when I talk about calls to action, I usually do it in 3 buckets: educate, legislate, agitate. Some people like to say advocate. I love agitation because I think that when people are uncomfortable in a process, it helps to move us a bit. So I say agitate. And while this is a very a time where we're all feeling good about what's happening in the Commonwealth, thank you, State Representative Vega, for taking this on. for being one of our health champions. We absolutely need you. We need to convert more individuals to be our health champions, but thank you so much for the work that you do. And I did see Senator Welch on his way out, who I also thank for being here, and to all of our legislators. This is also a very interesting time. We are watching at the federal level where there's the potential for a great deal of change. The Affordable Care Act may not look like it looks today. It may be something very different that puts vulnerable and underserved populations in really harm's way. When you look at the legislation and you think of the number of things at the federal level that the Commonwealth of Massachusetts will lose and other states in the nation, then you know that we are heading into the win. And so there may come a time when our health champion, State Representative Vega, may be faced with some real serious choices around cutting funding based on what's happening at the federal level. Now, you all know in 1799, the first health department was established in Boston. So we are first in the nation to have a health department in Boston, 1799. In 1869, the first state public health department was conceived in the nation. Guess where that was? The Commonwealth of Massachusetts. And so Massachusetts has always been on the forefront of assuring health, assuring public health, and assuring that all of the individuals in the Commonwealth, and what we do, quite frankly, the nation follows. We were the first state that had comprehensive health insurance for our residents, and the nation followed. So what I'm saying to each one of us is that it really is a very special time in our nation, but it's also a very scary time because some of our values may be under assault. And so it's important for those of you who have a voice to use that voice to advocate for individuals. Remember, advocate or agitate for individuals who don't have the opportunity to use their voice. I have been doing this work for a number of years and I have seen amazing things happen. But I'm looking forward to things happening where we can all celebrate the county health improvement plan and those rankings where Hampden County is not 14th, but we are moving up in a way that makes sense for the individuals we work with in the Commonwealth, particularly our young people. And so I've been asked to ask all of us to advocate, agitate, work with our legislators and educate around two things that have come out of the work that has been done in the Hampden County through Josh. Thank you for your work. Where are you? There you are. Thank you so much for coordinating and keeping folks together to do this work. The Pioneer Planning Commission, we have one of the top planning commissions in the nation who work with individuals in our community. So thank you to you for the work that you've done in keeping us together. Dr. McAdoo, I didn't know that I was going to get a chance to say hello to you. Where are you? You talk about somebody who has energy and who advocates. Our unintended pregnancy rate going down is really in a direct relationship to this woman's advocacy and her ability, again, to keep us all at the table and keep us together. Thank you, Dr. McAdoo. And to the public health practitioners guru, Dr. Robinson, thank you so much for always keeping us together and remembering that we should not work in silos, but we should work as a community, work together. I try to follow your example, but you know, there are days I fall short. I do not have your patience for process. And so, two things I've been asked is that the Massachusetts legislature establishes a statute that mandates a special CHIP commission to be created in each one of the counties across the Commonwealth of Massachusetts for the purpose of monitoring the progress of the strategies that we talked about as far as the plan is concerned. And we really believe that it be made up of representatives of local public health departments, area hospitals, and local community action organizations, which are reflective of county municipalities. The second one is near and dear to my heart, and that is that local decision makers support their local public health departments beyond the scope of just meeting our mandates. We know that Chapter 111 says that every city and town in the Commonwealth should have a local health department presence. Some of us have resources that are different than others of us, but all of us consider our job not only to meet those public health mandates, such as communicable diseases, such as our nursing services, such as assuring that all of our restaurants are safe for our residents to eat in. Some of these things are outlined in Chapter 111 in the sanitary code, and we do them well and to the best of our ability. But it's important that we understand that local public health really is that line. We are the vanguard. We are the ones that are out there every day assuring that the public has a healthy environment, working with all of you. But it's important that we strengthen our local public health departments and that we include and promote national policy, take resources to seek health equity, and support effective public health systems, which is very important. So, educate. Are you now? See, I need some. You gotta act like you like me up here, okay? I'm big on people acting like they like me. Educate. So we need to take up the mantle to educate. Whenever there's an opportunity for you to use your voice in a way that is positive around health disparities, health equity, the community health improvement plan, whenever that happens, bore people. Capture them. Make them run away from you because you've said too much. Then you know you're doing your job. Educate people. Continue to educate. And make sure that your voice is heard. Everybody doesn't have a voice because some folks are not empowered or have not seized their power, let me say, to use their voice. You can do that. We can do that. That's our job. Educate, legislate, working with our legislators such as our great state representative, Vega. I, quite frankly, will be contacting each one of the state representatives and senators in my district to let them know they were not here. They were not here. They did not send a representative here. It's important to me. It's important to the residents of the city of Springfield. It's important to all of the cities and towns in Hamilton County and across the Commonwealth. So I would ask you, if your legislator's not here, if you've not heard from them, then let's get out there, make some telephone calls. When you see them in the street, educate them, bore them, because sometimes they try to get away from us every now and then. You know you try to get away from us. Anyway, so they try to get away from us, but this is important. This is too important to let slide. So legislate. Make sure that you are talking to your legislators and advocate. I mean, I think that is the most important thing that we can do. You know, there is no movement that has happened in this nation or in this world without advocates. If we're going to change something, we change it through advocating. We change it through assuring that our voices are heard time and time and time again. So I'm going to ask you to advocate. Now, those of you who advocate really are a lot calmer than those of us who agitate. Because when we agitate, we just want to help folks feel uncomfortable about a situation where they should be having a voice, like infant mortality, like many chronic diseases, like some of the social determinants of health, housing, economic development, issues related to poverty. The biggest health indicator that we have around people not having access and affordability is what? It's poverty. It is absolutely one of the biggest issues that we have to address. So, educate, legislate, advocate, and agitate. That is my call to action. That is what I'm asking each one of you to do. That is what I am at. And I know this is the choir. We could get up, you could sing this song with me, right? But the other thing is sometimes we have to be reminded to sing the song because we get used to the fact that we're in rooms with individuals who might be like-minded. And so we have to take the opportunity to reach out beyond our boundaries and try and assure that we are reaching those individuals, even those who disagree with us. We've got to take the time to do that work. And so I look forward to working with you down this road as we create this commission, this CHIP commission, as we continue to support local public health, and that each and every one of you continue to use your voices to assure that we are making a difference, not only in the Western region, but in the Commonwealth of Massachusetts, and then we got to take on the nation. Thank you.
That's a lot of energy. That's awesome. Thank you very much. All right, folks, that is all that we have on the agenda for today. I want to thank you all for coming. I know that some people drove quite a ways to get here, and we really do appreciate that. You're welcome to stay. We're scheduled till 3. There's still some snacks out back. There's probably a lot of interconnections we can continue to make. So feel free to mill about, and thank you again for coming.
Thank you.